Hello everyone and welcome. My name is Olga Sergeyevna and this video is devoted to the fat-soluble vitamin D. It's no coincidence that it's so sunny on this slide, as this vitamin, its D3 form, Cholecalciferol, can be synthesized in our skin under the influence of UV light. The daily intake for adults is 15 micrograms, which is equal 600 international units. Vitamin D is found in animal food, sea fatty fish, cod liver oil, egg yolks, some mushrooms especially grown in the sun, and dairy products, especially those fortified with it. Vitamin D preparations are ErgoCalciferol D2, a more active D3 Cholecalciferol, and Calcitriol and Calcitriol. The name of each of these drugs includes the part calci, which is due to the fact that the active metabolites of vitamin D regulate calcium and phosphorus metabolism, ensuring their homeostasis and normal growth and development of bones and teeth. This occurs because vitamin D receptors are located in the intestine, kidneys, and osteoblasts, interaction with which leads to increased absorption of calcium and phosphorus in the intestine, and increased reabsorption of calcium and phosphorus in the kidney. Thus, vitamin D maintains calcium and phosphate level in the blood, and when it's sufficient, mineralization occurs, and vitamin D creates the condition for it. Therefore, vitamin D is used for the prevention and in higher doses for the treatment of vitamin D deficiency, which in infants and young children manifests as rickets, with a typical bone deformation. That's why vitamin D is called anti-rachitic. In adults, vitamin D is used to prevent bone softening, so-called osteomalacia, and treatment of osteoporosis, increased bone fragility and fracture risk. The vitamin D preparation Calcitriol in ointment form suppresses keratinocyte proliferation and is indicated for the chronic autoimmune skin disease psoriasis. Vitamin D can be considered a hormone. Why is this? Because it's synthesized in the skin under UV, transported through the bloodstream and activated. It acts on specific vitamin D receptors in target tissues. Its activity is regulated by feedback between blood calcium level and the active forms of the vitamin. Let's look at vitamin D3 biotransformation. Vitamin D3 produced in the skin, ingested through food or taken in supplements, is transported to the liver and undergoes hydroxylation and converted into its first active metabolite, 25-OHD or calcidiol, the primarily blood biomarker for vitamin D status. Next active metabolite, 1.25-dihydroxycholecalciferol or calcitriol, is formed in the kidney. In addition to bone tissue and calcium phosphorus metabolism, vitamin D exerts its effect through interaction with receptors. Vitamin D receptors, which are present in most tissues of the human body. This interaction affects the immune system, the proliferation and differentiation of epidermal cells, some malignant cells, neurons, skeletal muscle cells, the pancreas, and others. These are the so-called genomic effects or extraskeletal effects of vitamin D. Therefore, vitamin D deficiency plays a role in the development of endocrine, autoimmune, oncological, cardiovascular diseases, and infectious pathologies. The pharmaceutical market offers not only vitamin D drugs, but also a lot of its dietary supplements. In recent years, with the discovery of vitamin D genomic effects, attitudes toward vitamin D and its dose choice have evolved from a general fascination with it and its prescription for a huge range of diseases in higher doses, However, since 2024, according to the new guidelines for vitamin D deficiency, there has been a trend toward minimizing its prescription and doses. Therefore, take this vitamin with caution, keeping in mind that it carries a risk of hypervitaminosis D, which is characterized by hypercalcemia and calcium deposition in many tissues, possible calcification of the kidneys, lungs, heart valves, and blood vessels, leading to dysfunction of the organs. All this requires vitamin D discontinuation, long-term adherence to a low calcium diet, and the prescription of the mentioned drugs. Please rate this video and watch our other videos. Thank you for your attention.